So hey people, welcome to Doctor Academia. Today in our third episode of OPD series, we will be discussing about the brain-eating amoeba, which is also known as Naegleria fowleri. So Naegleria fowleri cases have been arising in Kerala for some time, and there have been some case of deaths also. So let's discuss it. So Naegleria fowleri is actually a free-living amoeba which lives in fresh, warm water bodies. So these organisms are inhabitants of water bodies such as ponds, lakes, rivers, hot springs, soil near warm water, and discharges of industrial plants and swimming pools. So, how do they look like? What is the morphology? So, morphologically, these are three forms: a cystic stage, a trophozoite stage, and a flagellate stage. Now, what comes important here is that the trophozoite stage, also known as the amoeboid form. And this amoeboid form is the main culprit of infection in our body. So, if anyone asks what is the infective form of Naegleria fowleri, it is the amoeboid or the trophozoite stage. So, this Naegleria fowleri, this free-living amoeba, how does it enter our body and how does it cause the pathology that we heard so much about? Let's see the life cycle. So, just as I told, this free-living amoeba lives in fresh warm water bodies. So, when we do some activities like swimming, water sports, or etc., these organisms enter our body through inhalation and it penetrates our nasal mucosa via the coliform plate. It enters and infects our olfactory nerve. Through the olfactory nerve, it enters our brain. And once it enters our brain, it causes meningitis, which is known as primary amoebic meningoencephalitis. And since there have been no effective treatment for us, the ultimate outcome most of the times is death. So, what are the clinical features that are presented by a patient who is infected with Naegleria fowleri? The incubation period is around 1 to 2 days to 2 weeks, and the initial symptoms shown by the patients includes fever with chills, nausea and vomiting, loss of taste and smell. And just as I told you, the ultimate symptoms will be due to meningitis. So all these symptoms will be followed by signs of meningitis, which include positive Burinski's and positive Kernick sign. Next, stiffness, lack of attention, ataxia, confusion, and seizures. And since there are no effective treatment, the mortality rate is more than 90%, which can happen if the patient survives within 7 to 14 days. So how you diagnose it? Diagnosing Naegleria fowleri is a little bit difficult. We have to do a CSF analysis, which is almost similar to bacterial meningitis. Cells will be predominantly permanent cells, polymorphonuclear cells. Protein will be high and glucose will be low. Another method is a phase contrast microscopy, where we will be seeing that organism in this stage, that is a flagellate form. Thirdly, by histopathological examination, the organism will be seen like this. And the culture which I found in the third year MBBS textbook was page saline and 1.5% agar culture. How you treat it? Just as I told, there have been no effective proven treatment for Naegleria fowleri, but there are some drugs that have some effect against Naegleria. So let's see what it is. So amphotericin B has been found to have some effect against Naegleria fowleri, and some other drugs like rifampicin, azithromycin, Antifungals like miconazole and voriconazole are also effective against Naegleria, or has a probability of effect against Naegleria. So these are used for treatment actually. So this is a very short topic I like to discuss with you guys because of the recent cases, and I think you guys understood it. Thank you.